Hello, all. I'm David. I'm a third year general surgery resident at Vanderbilt. I've been given the great privilege of speaking with you all today about my personal journey in STEM, and hopefully, I can convince some of you to pursue a career in what I believe is the best field ever general surgery. Yes, all the slide titles will be music related. We are situated in Nashville. I was born in Norfolk, Virginia, to first generation immigrant parents from China who came to the U.S. in pursuit of a better life. My dad was a urologist by training and came to pursue fellowship and research opportunities. Soon after I learned to walk, we moved to Brooklyn, New York. My dad would often take me to work, and sometimes his coworkers would call me Dr. Xiao, Jr. I loved that. I would often follow him while he went to see his patients, and while I don't remember much of the interactions, I do remember how grateful patients were and how proud I was of my dad. Thus, the seed was planted. For high school, I moved to a smallish rural town in Connecticut. My sister was an absolutely amazing human being. Every teacher loved her. She was the MVP of her volleyball team and first chair of her orchestra. My parents never had to push her, so they thought, well, David shouldn't be any different, right? Or so they thought. However, it resulted in them not really being controlling and just letting me be me. I was okay at school, but a huge letdown for some of these teachers that thought my sister was a once-in-a-generation gift to our small town. However, I loved biology, absolutely crushed it, and surprised my classmates when I got the highest score on tests repeatedly. So I go to college with a vague plan to pursue a career in medicine and start, like so many students, pre-med. It was not a very good pre-med. I hadn't developed good study habits. I saw a huge disconnect from the courses we had to take in medicine. And in all honesty, I was a bit lazy and was also unsure if I even wanted to pursue medicine. Summer of junior year, I was still lost about my career aspirations, and nothing really had piqued my interest. I stubbornly held on to pre-med, despite the most abysmal GPA imaginable. I thought, why not apply for an internship at Pfizer? The research and development site was 20 minutes away from my house. Despite not being anywhere close to their GPA minimum requirement, I applied, and despite listing my GPA, albeit in tiny font, they took me. And I started working on an anti-malarial medication for pregnant women that was undergoing clinical trials in sub-Saharan Africa. I worked alongside MDs who were overseeing the trial. Don't look for my name in that study. It was only a 2-month internship, okay? While I got no publications, I did gain a revelation that I genuinely wanted to pursue medicine, and I could be good at it. I started volunteering and shadowing emergency departments, and the love affair truly began. Now I returned from my senior year of college with a mission: turn this ship around. Despite all of my efforts and doing very well my senior year, my GPA was nowhere close to being competitive. My sister, meaning well, and also having had a roommate in college who was much more diligent than I was, who wasn't able to get into medical school, suggested maybe I should consider less competitive options. I calmly told her, I know I can do it and I will become a doctor. I did some intense Googling and found out about post-bac programs for students with lower GPAs who wanted to improve on their application for medical school. There are a few programs nationwide. I applied to Georgetown, and thankfully, they didn't think I was completely hopeless. It was truly one of the most competitive, intense, but genuinely fun years I've had. I was taking classes with first-year medical students on medically relevant topics. I soaked up everything like a sponge. Every minute detail seemed fascinating. I also knew that my chances of getting into medical school was still very slim, so I worked my butt off and gave it my absolute all. And praise be to God, I did well. It took 2 years of applying, improving my application of volunteering and clinical experience, and a great deal of luck, but I got off the wait list, and drum roll please, I made it back to Georgetown for medical school. I want to take this time to just really underline this very important part. Medicine is an amazing career for so many good reasons. And due to some time constraints of this talk, I won't go into the long list of personal reasons why medicine for me that have still held true today. But if it is truly your passion and you're willing to sacrifice and work hard, don't stop believing in yourself. And if you are unsure if medicine is right for you, find opportunities to help you make that determination. And when you do decide this is a life calling you want to answer, regardless of how bad you think your application is, please don't give up. There's always time to improve your application and many paths to medicine. Just make sure you give it your all from that point on and capitalize on every opportunity given to you. If I could turn it around, so can you. Now, for the next part of my talk, I would like to convince you, well, really show you, why general surgery, in my humble opinion, is the absolute best field of medicine. While I think if you ask my colleagues, they would give you a myriad of reasons, I will give you my top 3. Comprehensive care, life-altering, and instant gratification. So when I was in medical school, there was not a field I didn't enjoy in some part. I loved internal medicine. I thought to be a doctor, you needed to be grounded in medicine. I enjoyed radiology. I loved anesthesiology and emergency medicine and pediatrics. There was something important to be appreciated in every field in the care of patients. Even though I noticed myself gravitating towards procedures, I was not ready to give up some parts of medicine I thought were fascinating and very important in the comprehensive treatment of patients. And that is where general surgery came in. General surgeons take pride in their ability to manage patients' complex medical problems, review radiology and surgical planning, care for pediatric, geriatric, and pregnant populations, also provide critical care medicine. They want to take ownership in the care of their patients and be involved in every aspect of their care. I once heard that surgery is the most optimistic of disciplines. And it really stuck with me, and I found it to be true. Each time we take someone to the operating room, we give someone hope. Whether it is to stop the immense internal bleeding from a horrific accident and preserve their life, or to give someone a life-saving organ transplant, to take out cancer, to perform heart bypass surgery, and so much more. You can do all of that and more pursuing general surgery, and truly change someone's life in a very significant way. One of the best feelings in surgery is the instant gratification and seeing the immediate impact of your work. Seeing someone's new liver start working shortly after transplant, seeing someone feeling better after inflamed appendix is taken out, and telling patients and their families that the cancer was completely removed feels amazing when you're able to help someone and see the impact. There is truly no better feeling. Now, it's probably not a shock to everyone that general surgery is tough. It's one of the longer training programs, especially if you do research and fellowship. The hours are long during training, even compared to some other surgical specialties. The patients we deal with are often very sick. And while the highs are plenty, the lows are also common and tough. However, as someone who is in the thick of it during residency, I love being a general surgery resident and wouldn't trade it for any other profession. Also, remember that life gets better after training. Overall, I don't think the adage, find a job you enjoy doing and you'll never have to work a day in your life, adequately applies here. But for me and for a lot of my colleagues in surgery, we feel that we found our passion and calling. And for us, the hard work and sacrifices are truly worth it. Thank you once again for the privilege of letting me share my story. Please reach out to me with any questions I can help answer. Best of luck with your careers. I hope you find your passions in life and are able to live out your life callings.
Check out our website to find recordings of all of our videos. We'll get them posted about a week after each of the presentations. We can't wait to see you!